Antoinette.
Raminta.
Mohammed.
Vida.
Edwardas.
This is the symptom of high bilirubin level in the serum. Bilirubin is the product of hemolysis, thus this molecule is normally presented in the blood. The physiological appearance of bilirubin and its derivatives are seen in normal color urine, bruces, plasma also, and it gives brown color to the stool. The bilirubin normally undergoes biochemical processes, which includes conjugation. Jaundice is a result of underclearance, overproduction, or inability of the liver to conjugate the bilirubin. Jaundice patient will present with yellow color skin, especially eyes and mucous membranes, which you can see in the pictures. There are 3 types of jaundice, which is hemolytic, hepatocellular, and obstructive, and it's classified depending on the pathophysiology. The hemolytic jaundice patients present with darker urine and dark brown stools, and also with conjugated bilirubin found in a biochemical test. The pale clay-colored stools and dark urine is seen in the patient with hepatocellular jaundice, where both conjugated and unconjugated bilirubins are found depending on the pathophysiology. In the obstructive jaundice patients, clay-colored stools and bile pigments in the urine are seen, and also conjugated bilirubin is found in a biochemical test.
The main source of bilirubin, which mostly is produced from all erythrocytes. So H erythrocytes are noticed by the macrophages of the spleen, which can convert heme to biliverdin, carbon monoxide, and iron. And biliverdin is further reduced to bilirubin, which afterwards binds to albumin, which is carried to the liver, just because the unconjugated bilirubin is toxic to the body and is insoluble in water. In the liver, it will be converted to conjugated bilirubin in the presence of UDP-GT enzyme. This form of bilirubin is not toxic and soluble in water, excreted to the bile, and then it penetrates to the intestine, where bacteria converts conjugated bilirubin to stercobilin or urobilinogen, which is excreted with the feces and is responsible for brown feces color. However, some urobilinogen is resorbed back to the blood system, where it can go back to the liver, or it can be eliminated from the body via kidneys, and it gives yellow urine color.
Jaundice does not arise from one specific disease. It has many underlying diseases, and these are grouped into hemolytic, hepatic, or obstructive. Hemolytic jaundice is caused by increase in hemolysis, and also, as well as an increase in bilirubin concentration. Because of the increased workload of the liver, unconjugated hyperbilirubinemia occurs. In severe cases, the toxicity of this leads to kernicterus, which is an increase in bilirubin accumulation in the grey matter of the CNS. Other ways hemolytic jaundice occurs is because of anemia, thalassemia, or sickle cell therapeutic, or spontaneous abortion. Erythroblastosis fetalis is another way hemolytic jaundice can occur. Blastosis fetalis happens when an Rh negative mother can become Rh sensitive if she produces antibodies for Rh positive baby. This affects the second baby, as the antibodies from the mother now cause hemolysis on the baby's red blood cells, and therefore leading to jaundice from hyperbilirubinemia. Cellular jaundice can be caused by infectious diseases such as viral hepatitis, or from paracetamol overdose. This is because acute hepatic necrosis occurs, and the damaged hepatocytes cannot conjugate enough bilirubin, leading to toxic hyperbilirubinemia. But normally, this defect is from bilirubin metabolism. Now watch this clip to understand. Jaundice occurs when there's a blockage in some way in the enterohepatic circulation due to some sort of cancer, e.g. pancreatic, liver cancer, or cholangiocarcinoma, which is a cancer of the gallbladder. Examples are cholestasis, which is the obstruction of bile due to gallstones.
Jaundice can be diagnosed first by checking patient's medical history. This is done to check for any patterns that might lead to jaundice disease. Next step is physical and or visual examination, where the doctor checks the patient's liver, legs, ankles, the color of eye sclera, color of the skin, and the color of feces. Blood tests can also be used to diagnose jaundice. In blood we check for bilirubin. Bilirubin in babies can be tested by using transcutaneous bilirubinometer. It is done by analyzing how beams of light reflect from the skin. Jaundice can also be detected by testing a urine sample, in which we check for urobilinogen. Ultrasonography is also used to detect jaundice, by which we check for abnormalities in the abdomen or any obstructions in the bile ducts. Bile duct obstructions are most commonly checked by the CT or MRI scans, which you can see in these pictures, because they give the best results to check for bile duct obstructions.
Okay, the complications of jaundice can be categorized into two groups. One is neonatal jaundice and the other is adult jaundice. Neonatal jaundice can be subcategorized into physiological jaundice and untreated physiological jaundice. The other categories for adult jaundice is based on the onset of the disease that they previously had. For example, hepatitis B, hepatitis C, and cancer of the liver. Physiological jaundice in neonates can be separated into two. It can be separated into breast milk jaundice, breastfeeding jaundice, and it can be separated into kernicterus. As physiological jaundice can occur in neonates between 1 to 5 days, usually because of an excess of red blood cells breaking down in the body during trauma because of childbirth. This should usually disappear within 1 week. If not, yellowness of the skin can occur. After 1 week, newborn babies, if their liver's unable to function properly, they are unable to remove the bilirubin from the blood, and it can lead to much serious causes. Breast milk jaundice normally occurs due to breastfeeding when the mother is unable to breastfeed the child. It can lead to the babies having mild dehydration, which prolongs and intensifies physiological jaundice, making removing bilirubin from the body harder, and the baby's, the lack of fluid that the baby receives can actually lead to the baby having kernicterus. The baby has excess bilirubin in the bloodstream, which is transported to the brain. Kernicterus is also the yellow staining icterus of the deep nuclei of the brain, normally in the basal ganglia. Symptoms can be divided into abnormal neurological function with auditory brainstem responses, ABRS, and neuropathological lesions. Newborns usually have abnormal movement, which is a cause of the selective lesions in the basal ganglia. Abnormal tone are classic signs of acute bilirubin, hearing loss, deafness, high-pitched cries, decreased feeding, arching of the neck, and inconsolable crying.
There are two types of treatment, one for neonates and one for adult jaundice. The type of treatment in neonatal jaundice, the first type is conventional phototherapy. This involves the use of fluorescent halogen lighting, as you'll see over there, where the light causes the bilirubin in the blood to be converted into waste products, which will be excreted out of the baby's body via the urine. The second type is fiber optic phototherapy. This involves the baby wearing a fiber optic blanket, and fluorescent and halogen lighting is surrounded around the baby's body, which once again will convert the bilirubin in the blood into waste products which will be excreted out of the baby's body. The final type is an exchange transfusion. This is in extreme circumstances. During exchange transfusion, blood from the baby will be removed as this has elevated levels of bilirubin. Then a donor will now donate blood. As this donated blood has not got elevated levels of bilirubin, the concentration of bilirubin in the baby's blood will be decreased. In each case of adult jaundice, there's no definitive treatment for adult jaundice. However, there are some treatments that are known to minimize the damage done by adult jaundice. The first type is regards to hemolytic jaundice. It is necessary to treat the underlying conditions such as malaria with antiviral drugs. During hepatocellular jaundice, this is more like damage limitation. So for example, removing stuff like alcohol from the diet, which will further damage the liver, is necessary. In extreme cases, there will be a need to remove the liver. The only treatment for obstructive jaundice is surgery. This involves unblocking the bile duct.